Eric, you want to put our chart up? I had our team run the data again this weekend as far as the deaths. And again, this is really what informs us. And I know sometimes people are saying, well, why are you doing it this way? Why are you going it by age? And age is just the best predictor, sadly, of possibility of death if you get the COVID. So 80 and above constitutes 53% of our deaths. 75, 79 is 14%, 70, 74 is 12%, and 65 to 69 is 8%. So you can see the great bulk is in this group that we are working on now. Next week, we will add people who are 75 and older. Again, that goes all the way up, though. If you're over 80, you're still eligible, obviously, next week. And we know that the majority of people who are 80 did not get it this week, will not be able to get it this week because of the supply. We've also talked about medically high-risk Ohioans who are under the age of 65. And we've carved out this group of individuals, and we want to talk a little bit in more detail today in regard to this group. And Eric, if you can put that slide up, well, that shows that group. Next week, not this week, next week, we will open vaccinations for those Ohioans with severe congenital, developmental, or early onset medical disorders that makes them particularly vulnerable. We have divided this group of individuals, and Dr. Vanderhoff will go through this and we'll list all the different items that are listed here of people who qualify. But I want to say this very carefully. We've divided this group, and here's how we've divided it. And again, this whole group was picked because of their risk of death if they got the COVID, high risk of death if they got the COVID. That's why this group was picked, signaled out by the medical professionals. We have taken this group, and everyone in the group will be able to get the vaccine at some point, but we've divided this group, and here's how we have divided it. And again, the division that we're making is based upon likelihood of death if they get it. So the first group will be those Ohioans with severe congenital, developmental, or early onset medical disorders that makes them particularly vulnerable, and who have a developmental or intellectual disability. Who have a developmental or intellectual disability. For those persons with an intellectual or developmental disability and one of these conditions, your local county developmental disabilities board will reach out to you. Let me again say that. For those with an intellectual or developmental disability and one of these conditions, your local county developmental disability board will reach out to you to help coordinate receipt of the vaccination. Again, these individuals will be contacted by their local county developmental disabilities board. Local health departments and our state's children's hospitals have agreed to work with our boards of developmental disabilities to help coordinate these vaccinations for some of our most vulnerable residents. In 3 weeks, so this will start this coming week for these individuals. In 3 weeks, the week of February 15th, people who have any of these conditions and do not have an intellectual or developmental disability will be eligible to receive the vaccine. As we lead up to that, further guidance will be forthcoming as we get closer to that date. Dr. Vanderhoff is joining us now to talk more about this group of medically fragile Ohioans. Doctor?
Thank you, Governor. Well, as you noted, for quite some time, we've spoken to the fact that the risk of dying from COVID-19 increases greatly as we age. But we've also recognized that, as you said, there are some conditions that begin earlier in life and are also associated with severe COVID illness in younger adults. So to identify these conditions, we looked to the CDC for guidance. And beginning with the CDC's list of pediatric medical conditions, we focused on those conditions that persist into young adulthood and have strong evidence of risk. The result is the Ohio 1B list for severe congenital, developmental, or early onset medical disorders that the governor referenced. Now, just as we began our 1B vaccinations with those 80 plus because they're at the very highest risk among seniors, and then are moving to other seniors, so we'll begin vaccinations for this group with those who have the developmental and intellectual disabilities the governor referenced, plus one of the conditions on this list. And the reason for that is that it is those on this list who also have these disabilities who appear to have the greatest risk within this group. Again, when it's time for these individuals, those who have been identified with developmental or intellectual disabilities, to receive their vaccine, they'll hear from their Board of Developmental Disabilities. They will receive outreach. Again, individuals who qualify for this highest risk can depend on that outreach. But in a few weeks, as the governor noted, we'll open 1B vaccinations to the rest on the list. And of course, more guidance will be forthcoming. Finally, just a couple of quick reminders about our vaccines. These vaccines, in accordance with the CDC guidelines, are only available to people who are, for the Pfizer vaccine, 16 or older, or for the Moderna vaccine, 18 or older. So these are not pediatric vaccines. These are also, and the governor has noted this, 2-shot regimens. People should receive the second shot of the vaccine at the specified interval. And it's different for the 2 vaccines. For Pfizer, that's 3 weeks. And for Moderna, it's 4 weeks. So very important information to bear in mind. Governor?
Doctor, thank you very much. Let me turn